Okay, so with that being said, we will get started. Welcome, everybody, dear students. Welcome to our session today with our team. We'll be talking about what's next after EE, what you need to know about the PBCs, answering any questions you may have. It is a lengthy and difficult process, so we are here for you. And the evaluating exam results just came out, so it is super, super exciting. So welcome. I will pass it to Dr. Permeet to kick us off.
Awesome. Thank you, Dr. Farah. So welcome, everyone. Before we begin, we do want to give a quick introduction of who we are and what the team has to offer. And that being said, meet the faculty. I'll start off with myself. So my name is Parmeet. I am one of the directors here at SolRx. I've been a practicing pharmacist for many, many years now, and I originally started off my journey as a manager at Shoppers Drug Mart. So I managed the pharmacy for a couple of years. I also worked at Sick Kids Hospital as a researcher for pediatric oncology medication. And I still do work in community pharmacy, particularly at Shoppers Drug Mart as a consultant. So in case there is any ever pharmacy incidents that occur in the pharmacy, I would kind of step in and investigate the issue and protect the pharmacist. The reason is if the incident is severe enough, and sometimes complaints do happen, the college begins investigating the pharmacy. And my goal is pretty much to make sure that I try to protect the pharmacist as best as possible. Besides that, I am one of the main instructors for the management portion of the course for MCQ, and I am one of the main instructors for our OSCE program. We are also leading one of our newest ventures, which is the Canadian Red Cross Partnership. So we are offering certifications in first aid and CPR as well. Before I move on to letting the rest of the team introduce themselves, I will introduce two people that you see on the screen, but not in our meeting today. First one will be Vipul Shah. He is actually the founder of SolRx, and he wasn't able to make it today, but he sends his regards and says hi to everyone. He is very busy with the OSCE program as he does instruct that as well. And then we have Dr. Hyung Yoon, which you see on the bottom right-hand corner of the screen, and she is our calculation specialist. She is also one of our main instructors as OSCE and focuses primarily on calculations for our MCQ students. She has many, many years of calculation. She actually taught calculations back home as well. And she is also a practicing pharmacist and full-time with SolRx. So now I'll hand over the mic to Arav, and he's going to introduce himself, and we'll quickly introduce the rest of the team and move on with today's session.
Thank you, Parmeet, and welcome everyone. My name's Arav, one of the directors here at SolRx as well. And like Parmeet, I have been a pharmacy manager, am a pharmacy manager, and I also own independent pharmacies and have owned independent pharmacies in the past. So a lot of management experience on my side when it comes to managing staff at the pharmacy, managing patient interactions, and all of that experience that we've gained over the years, or that I've gained over the years, I really truly want to pass on to all of you guys and share the Canadian pharmacy practice environment, any issues, how do we deal with them? And a lot of our course is actually based on the issues that we've faced as practicing pharmacists here in Canada. I practice in Ontario and have been a pharmacist for 15 years now, and I'm a UFT graduate, like Parmeet, and I guess the rest of the faculty as well, Parag. And I really, the thought process that was taught to us at school, also like Dr. Farah, who's from University of Waterloo, the thought process that was taught to us, that's the thought process we want to pass on to you guys. So even you all are already pharmacists, but there's something that's slightly different when you come to Canada, when you're international grads, and that's the experience. That's where we come in, and that's what we want to talk to you guys about. So welcome, and we look forward to meeting you virtually and some in person. And good luck with the exams, and we're here for you guys. I'll pass it on to Parag now.
Thanks, Arav. Good evening, everyone. Hello. We're very happy to be here. My name is Parag. I'm one of the management specialists as well. I'm a 2010 graduate. Arav and I actually were in the same class at U of T. We have 15 years of experience, which is kind of scary, but we do have a wealth of knowledge when it comes to management. I actually introduce myself as a community pharmacist. I am very passionate about community practice. There's a big need for bringing the energy and care and empathy every day in the front lines. I've been with SolRx for several years now, and today I will be taking the lead on introducing what we have to offer from the management portion. So looking forward to meeting you virtually and in person one day. And I want to pass it on to Dr. Farah.
Hi, everybody. Hi, dear students. Thank you for joining us today. So along with the SolRx team, I've been supporting students with their PBCs and their pharmacy journey for about 10 years now, and it's always been one of my biggest passions. I've worked in community, hospital, different settings, academia, and I look forward to sharing everything with all of you, along with our team at SolRx. So thank you for taking the time today. So let's jump right into it and talk about the MCQ qualifying exam and how it differs from the evaluating exam. So your evaluating exam is different because you need a 60% score to pass. Whether it's biomedical sciences, whether it's therapeutics, whichever area it is, you need a cumulative score of 60%. And that is different from the MCQ exam. In the MCQ exam, they look at how you do on each question and compare that to everybody else writing. And then they may increase or decrease the weight of each question to come up with a passing score. And we'll touch upon that a little bit later, but it is a little bit more confusing and not as straightforward. Your evaluating exam has no pre-test questions, so each question counts towards the score. In the MCQ exam, there's something called a pre-test question. Do you guys know what pre-test questions are? Have you heard of pre-test questions? Because I always see people get confused when they go from evaluating to MCQ, they get this concept confused. Have you guys heard of it before? Pre-test questions? And if not, you can say no. Maybe no. So pre-test questions are questions that questions that do not count towards your score. So the MCQ exam, you can say about 25% of your exam, so 50 questions are pre-test. So they don't actually count towards your score. They're there for the PBC to see how students do on questions and potentially use them in the future. Okay. And what's frustrating for people who write the exam is you don't know which one's a pre-test. Usually, I mean, based on the years of experience, we've noticed or we can assume that pre-test questions are those that are really beyond the scope of practice of an entry to practice pharmacist, something that's very, very out there, or that's not within a non-specialized pharmacist scope. But we don't necessarily know for sure. That's what we assume. But 25% of your exam not counting is a lot. And when you're attempting the exam and you're asking your mind, does this count, does this not count? That also kind of has a mental load on you. And that's how MCQ is different from EE. So in EE, every question counts. In MCQ, not every question counts. 25% doesn't count. And it's usually the questions that are out there or beyond an entry to practice pharmacist scope. Your PBC exam is defined as entry to practice knowledge. So something that every pharmacist coming into the profession practicing should know. So it's not necessarily looking at very specialized knowledge of second, third line treatments. It's understanding the general treatment practices, which is what we highlight. Your exam itself is about 4.5 hours. You have for the MCQ, and then you have a survey, and you get time to kind of settle in, and get yourself oriented. And then when you divide it out, it gives you a little bit over a minute a question, which is not a lot of time. And so what I always tell students, and we'll talk about this in the course, but we talk about how to approach the exam, how to crack it. I always will see students start the exam, they'll tell me they'll have questions they don't know how to attempt, then they'll get stuck, then they'll get fixated, and then they'll lose time. So I remember when I did my exam, I didn't know the first, 10, 20 questions, I froze. So I went to the back, I did the questions I felt really confident in, and then I worked my way. And so we'll give you different tips and tricks that you can use, but you get about a little bit over a minute a question. So that's not a lot of time if you think really much about it. So talking about these pre-test questions, and you can take a moment to read the slides, but remember, 25% do not count towards your score. And so you have to be very, very careful when you are attempting the questions. If you don't know something, skip it, come back later. And these pre-test questions are there for the PBC to see if they can use them in the future. So take just a moment to take a look at the slide to understand it better, and then we can keep going. And again, your evaluating exam does not have these pre-test questions. This is specifically for the qualifying exam MCQ. When you were preparing for your evaluating exam, you had a PBC syllabus. There was a blueprint of each topic, what is covered, like under therapeutics, migraines, headaches, different specific topics that are tested even in management or calculations, biostatistics, among others. And as we know, recently evaluating exam, they took out some components of physiology, pharmacology. But regardless, there is an extensive PBC syllabus, and it's over 50 pages long. And they walk you through each topic. The MCQ exam is different. They don't walk you through each single topic for you to study. Instead, we are looking at the NAPRA competencies. So NAPRA is the National Association of Pharmacy Regulatory Authorities. And they have these competencies, which are listed here. And the PBC exam questions are based on each of these competencies. You have ethical, professional responsibilities, patient care, distribution, practice setting, health promotion, among others. Okay, so both MCQ, the written exam, and your OSCE is based on all of these competencies. And they won't break it down on your exam. It won't say, these questions test at the ethical legal responsibilities. It's all mixed together. And one of the biggest issues I'll see for students is they'll attempt a question and they will think they're being tested on a clinical concept, but instead it's not a clinical concept, it's a health promotion related concept. So it's about training your mind to identify which competency is being tested and then how to approach those questions. So that's something to also be mindful of. Okay, how is this exam scored? So like I mentioned earlier, evaluating exam, it's just flat 60% cutoff. MCQ is different. You don't have to know the exact details of how they score it, but we have this written for you based on what the PBC says of how they test it. So essentially, they look at how each person does on each question, and they will adjust the weighting accordingly. That is at a high level. So what I will tell a student is if you found a question hard, it is very likely that majority of your colleagues also found that question hard. So it is likely that that question may have a lower weighting. So it's always good to attempt the questions and the topics you know well. If you struggle with calculations, leave that till the end. And it's likely that if you struggle on a specific calculation question, others may as well. And the reason why the PBC looks at each question independently is to make sure that the exam is fair for everybody. And everybody will get a different set of questions. No exam is completely the same. Of course, people will get the same question, but no exam is completely the same. They have many different questions and they are shuffled for different people. So is using a question bank and past exam questions enough, or is formal training essential? What do you guys think? And this is very tricky because a lot of people will call me and say, Farah, can I just practice questions? Can I use past exam questions? So here's the thing, honestly speaking, for MCQ especially, your evaluating exam is like the base where we're testing basic concepts. Your MCQ builds on the evaluating exam and asks you more complex questions. So MCQ is a step further than your evaluating exam. So if you are just memorizing concepts and practicing questions, it is not sufficient to pass your exam. You need training in how to approach complex scenarios. Like today, we had a class in the morning and we had a Parkinson's disease lecture, and I was talking about how I had a patient with drug-induced movement disorders that looked like potentially like Parkinson's disease. And I talked about how I identified it. My patient was pacing and had involuntary movement, was restless, and was walking 5 kilometers a day and felt urges to move. And she never had that in her life. And then we figured out it was related to the increase of her aripiprazole, and it went to a high dose of above 7.5 milligrams. And because of that, she developed extrapyramidal symptoms. And that was based on practice experience. And we talk about how to address it, for example. So these are the type of things they can test you on, because MCQ is one step further than EE. So you're taking those baseline concepts, really applying and analyzing them. And I have seen people do thousands of questions when studying for MCQ, and I'm not exaggerating, but actually thousands of questions and still not successfully clear the exam, because there are so many different types of questions, and just practicing will not develop those skills. And there's no real such thing as past exam questions. Remember, we all know there's something called recall bias. So you may believe they're testing you on something when you're reading a question on your exam, but because of the stress on your exam and reading it quickly, you may be misreading the question. And I see that happen quite a bit when I speak with students. So that's also something to be mindful of. So formal training is essential in order to grasp the key concepts. So formal training is essential. It is beyond memorization, okay? Guidance from experience is required, how to deal with situations in practice that are gray. Not everything is written. So it's a step further than evaluating exam. And again, the old question trap, you cannot rely on that. There's also your recall bias. So just practicing, again, not enough. We are going a step further. And CPS is super important. So we cover important concepts from CPS, but also we have to look at other sources like Public Health Agency of Canada, Canadian Pharmacists Association. We look at different tools to help educate you and improve your knowledge and improve your chances of passing the exam. So these are just some examples of different topics that are covered. But ultimately, the knowledge is based on the CPS, which is the most important source for the therapeutics concepts for your exam. So do you need multiple clinical sources to prepare for PBCs? At SolRx, we cover everything for you. You don't need external sources. And some people will say you need to go back to the evidence-based guidelines. Yes, guidelines and evidence-based sources are very important. However, if there is a discrepancy between CPS and the guidelines, it is either not going to be tested or CPS will take precedence. So that's also something to be mindful of. In evaluating exam, The questions, I mean, it varies, but they seem to be very straightforward of looking at first line options. In MCQ, we are looking at first line treatment options, but then we're going a step further to look into depth of patient preferences and how to manage additional situations of non-compliance and complex scenarios. So you basically would need CPS, but also you would need to be involved in extensive discussions to grasp the underlying concepts. And there is no such thing as high priority. It's all about studying smart for this exam. I would be lying to you by saying you can memorize everything and know everything. It's virtually impossible, and nobody knows everything. That's where evaluating an MCQ are similar, where it's impossible to know everything. So we try to guide your studying and help you study smart. Because if I've seen people study and review material multiple times, I've seen people study for months full time, not working, studying full time and not pass. Then I've seen students work part-time, study part-time, and pass. So it's more about the method rather than the quantity. And this is where evaluating an MCQ are similar because it's about the quality of studying versus the quantity. I would be thrilled to pass it on to Dr. Parag to jump into calculations and management as our expert here. So take it away, Dr. Parag.
Thank you so much, Farah. Okay, so that was a good kind of preamble or introduction to how to think of the qualifying exam versus the evaluating. Dr. Farah talked a little about therapeutics and clinical practice and those competencies when it comes to preparation. Now, we're going to switch gears a bit, okay? The one question you see in front of you is how should students prepare for calculations and management? Now, before we kind of go into the details, I thought I asked, everyone here, how do you feel about the idea or even the management competencies? Like, how does it make you feel when you think about the management ideas or topics that one is expected to know? Any thoughts? Like, is it something that's completely unknown, or is it clear cut? Would you say it's black and white? What are your thoughts? I know in EE now, you start to kind of bleed into a little bit of this because ultimately the regulatory bodies and the PEBCs, the people that make these exams, they want us to be ready for practice, okay? Entry level practice. So do people like the idea of having calculation questions? Do they feel more comfortable with management questions? What are your thoughts? If you guys can put some thoughts out in the chat so I can get a feel. So I think everyone is anxiously wondering and waiting for me to kind of give my thoughts. We feel confident. Okay, I like that. All right, you feel confident. Anyone else share that sentiment? Is it always clear cut? Is it something that you can go back and look up the source, look up the information in CPS, for example? Not always. Thank you. Some gray areas. That's huge. I also see here time management can be tricky. Absolutely. But if you can break it down, if you understand what you're being asked and you can relate it to practice and real life situations as much as possible, then that will allow you to figure it out. Some things are more clear cut than others, but it's definitely a different way of thinking about it. Dr. Farah?
Yes, absolutely. Absolutely.
Yeah, next slide. Thanks. Perfect. Thanks. So as some individuals here already alluded to, it's not always black and white. And so the exam, just so we might have already mentioned this, but it's broken into three things, right? There's patient care, which is like therapeutics, and then there's management and then calculations. So management can be considered everything other than the clinical practice, okay? So once again, some management topics and ideas are not black and white. We have to understand the thought process and the concepts involved, okay? A perfect example of this is professional ethics, which is a key competency, right? That makes up management questions that we have to use in daily practice. Is actually very, very important. There is no algorithm, there is no formula that can give you a solution. So we have to think a bit deeply. But it's not something that we can't tackle. If you understand the little pieces that are involved well, then you can create a proper, clear understanding and therefore the answer. One of the things I want to mention to you right away, that's something you should keep in the back of your mind, is the PBC, the exam, they're testing and trying to make sure you understand what real life practice is about. So relating to real life pharmacy scenarios is going to be very important moving forward. Basically, just like what I have here, think when you are answering a question, especially when it comes to management, think like a manager. Think like someone that is responsible for the pharmacy workflow. Think like someone that is dealing with a patient or someone in front of you and trying to help them with their drug therapy. Okay, that's how I would orient your thinking when you're looking at management. Next. So again, these questions reflect how things work in practice. And so that's why with SolRx, I can say with confidence, which I'll talk about in the next slide, every single person here, every single person that you see is a practicing Part A pharmacist. All right. We are talking the talk and walking the walk, right? In a sense. So that's where we come in and we can bring in real life examples. So there we go. Exposure to Canadian pharmacy practice, even if it's indirect, because unfortunately, some people have the experience, some people don't. But just because you work in a pharmacy doesn't necessarily mean that you have the right orientation, because as an assistant or student or technician, for example, you're kind of have tunnel vision, you're asked to do one thing, especially in a busy practice. So in this type of setting at SolRx, we're able to expand upon it, right? Next. Okay, so kind of already alluded to this, what to look for, especially when it comes from management in a prep course. As we said already, it doesn't just test clinical knowledge, right? It oftentimes, management meaning, is the most challenging part, as some of you already mentioned. So what to look for then? You want to have instructors, like I said, that are actively practicing. I cannot stress this I can stress it's very important like, for whoever's talking to you to be pharmacists. Like I came straight from work today. I'm wearing the lab coat at work today. Like I can tell you the scenarios I went through today. That intangible information and experience just makes the teaching that much more enriching. And I can say that for Dr. Farah, or Dr. Parmeet, Arav, and Hayan, okay? So our organization, our team, we believe from top to bottom that it should breathe and live pharmacy. So from leadership to ownership to the directors to the instructors to everything, they're all pharmacists, okay? And we're all Canadian trained. That just helps, of course, because obviously the PBC is a Canadian-based board exam. Okay, so again, all these things are different layers as to how it's going to help support you guys even more. So a strong course doesn't just teach you what management is, it shows you how to think like a pharmacist working in Canada. And, you know, it can be quite, you know, some people think, oh, it's quite obvious or quite straightforward. It's not. And that's not how we feel. We feel that we need to kind of break it down from the very bottom and expand upon it. So everyone has a clear picture. And we always try to bring everyone on the same page. Next. So I think we already mentioned this about calculations. It can be a little tricky. I think some of you said that you're good with calculation. So what is it that makes it difficult? It's not like in school where, you know, you're just given a test and you just do it and simple arithmetic and straightforward. It's not. you need more than just a formula sheet. If you can keep going, Dr. Farah. So it's not just about memorizing, especially the calculations. We have to relate it to a real practice situations, right? And Dr. Hayang, she does a great job with that. Actually, we're in the midst of it right now with some of our candidates in our current course, and so we're very thankful and appreciative that we have a dedicated calculation expert, and so then we can pass that on to you, right? So I think that's very important. And of course, I mentioned we do work with real life pharmacy scenarios. And this is what they're going to be testing you for, right? This is what they're going to see. Can you do it? Can you relate this formula to a real life clinical scenario, right? Whether it's dose loading or the interval for how often to give IV medication in a hospital setting. Very simple example where you would tie in pharmacokinetics. So we need to take the theory and apply it to real life. So what is the hidden challenge? And as some of you may already know, that the majority exam actually is not even clinical practice in a sense that it's not just therapeutics. Dr. Farah. So it's actually not even like the majority of it is nothing to do with medications in a sense, right? Yeah, we can focus and read and understand the drugs. Very important, huge part of the exam, of course, but there's a whole nother section and we cannot ignore it. And we cannot just kind of glaze over it. We have to really put our energy and time in understanding it, right? So ethics, pharmacy operations, decision making, right? How would one deal with a conflict? Like, that's something you'll have to deal with, right? In practice, it's the gray zones. So the question I have for you guys and something for you to ask yourselves, are you prepared? Do you have the ideas or the tools and a strategy of how to learn this part? That's what we can offer. Okay, so kind of already touched upon this, but a non-patient care competency is more than just knowing the drugs, right? So can some of you tell me some of the non-drug competencies that come to your head very fast? Like the first things that come to your head. What are some main, I guess, non-drug competencies that you focus on? Already mentioned ethics. Any other ones that you guys know about? So other ones, as you can keep going with the slide, Dr. Farah, pharmacy management. This is what I tell my staff, and this is what I tell you myself. When I am on shift, the buck stops with me. I'm the one that is ultimately responsible for that patient. I'm the one that's responsible for that clinical situation. I have to make sure that the right drug gets to the right patient at the right dose at the right time. I have to make sure that my staff is aware and able to help that patient. So that is something that we have to be involved and you should be aware of as well. Decision making under pressure. What are the legal implications, the ethical dilemmas? Interprofessional collaboration. How many of you have any experience working with other professions? Maybe back where you guys are trained. Anyone have any experience? How many of you love working with doctors? Me, you love working with doctors? Excellent. I love that. I don't mind. Yeah. So it's very important in understanding what the healthcare team does. Maybe in the past, professions worked in silos, right? Very compartmentalized by themselves. That's not how healthcare works. And there is a real push for intercollaborative healthcare, interprofessional collaboration, for example, right? So we have to understand that when do we refer? Really important. And I can tie that into a very important thing that pharmacists can do now over the last 1 to 2 years. Can anyone tell me what's something new? This is across the board in almost all provinces. But what is something that pharmacists are now able to do that they were not able to do before? Something really unique and important? Anyone have an idea? Yes, thank you. Excellent. Minor ailments, minor ailment prescribing. That's a huge thing that pharmacists can do. It relieves burden on the healthcare system, and we can provide real healthcare very quickly. We are utilizing our actual knowledge. It's very exciting and it's very good. But that doesn't mean we just give a prescription and here you go, have a nice day. We have to really understand what the patient needs. Are there any red flags? And how to communicate this effectively. I went through the same situation this morning. There was a patient that came in and she wanted to get a prescription for urinary tract infection, right? And so I went through my assessment questions and there was a red flag. She was a little disappointed, but after I explained to her that, it would be a disservice to you, it would potentially cause harm if I just prescribed nitrofurantoin, 1 capsule twice a day for 5 days, and you on your merry way. What if it was a more severe infection? What if it was an upper UTI, right? What if she's had recurrent UTIs? So we have to always keep this in mind. And of course, there's quality control and many other things. Okay, so it's not always easy to pinpoint. It's sometimes difficult for self-study and often misunderstood. Therefore, it's important to have a plan and ideally a coaching or prep course. So therefore, we are the experts in the gray area. If you can keep going, Dr. Farah. So we were the first to specialize in management. That's a fact. And now we have a revamped version of it, which we're very excited for. Keep going. So we break down complex topics to give you easy to learn strategies in certain situations. We helped a lot of people, okay, to kind of tackle the blind spot in the exam, right? We just don't want we don't want this being a pitfall, right? Communication. It's a very small competency, but we have to understand it. It's something we can do, right? Don't leave 58% of the exam to chance. Okay, so now let's get to something a little more fun. We're going to now give you a scenario, and this is exactly how we conduct our class. This is going to give you an idea of how it's important to relate our concepts to scenarios and break down the concepts so you guys understand clearly, okay? So this is just to illustrate kind of the approach that we have when it comes to our management section. All right, so let's talk about the scenario. So a 59-year-old male patient approaches you at the pharmacy requesting a refill for his hypertension medication, indapamide, 1.25 milligrams once a day. He was initially prescribed this medication 2 months ago by his primary care physician. Upon reviewing his medication profile, you observe that he is 35 days late in obtaining his refill or his next fill. Also, we realize he has no refills left. The patient was also asking if we received a requisition for blood work. First of all, does anyone know, or can someone tell me what does requisition for blood work mean? What does that mean? What is a requisition for blood work? Is this need to do blood work? Yeah, basically that's what it is. But we can't just walk in, at least in the provinces of Canada, we can't just walk in to a laboratory without almost like a prescription for lab work, which is known as a requisition. Now, even at work, sometimes patients, they don't have email or they want to make sure that the doctor or nurse practitioner wants to make sure that the patient gets it. They fax it directly to the pharmacy and then we can give it to them. Okay, so this patient here was also asking if we received a requisition for blood work from his doctor's office. The patient mentioned that his doctor had concerns of potential hyperlipidemia and pre-diabetes and needed more monitoring. Okay, so increased lipids, and potential issues with sugars. Given the patient's history of refills or filling, compliance, and the hypertension management, what would be the most appropriate initial course of action to ensure optimal patient outcomes? Using your professional judgment, issue a short-term emergency extension of his medication, but only after thoroughly assessing the patient's understanding of his treatment plan and any potential reasons for his delay to ensure compliance moving forward. Contact his primary care physician to request a prescription renewal, while simultaneously reviewing the patient's history of medication adherence and discussing any possible adjustments to his treatment plan to address his hypertension effectively. Initiate a comprehensive dialogue with the patient by asking open-ended questions about his medication adherence, exploring his lifestyle, stress levels, and any perceived barriers to maintaining a consistent medication routine. And finally, provide the patient with a limited supply of 5 tablets, emphasizing the importance of immediate follow-up with his physician, but also advising him on potential lifestyle changes that might help manage his hypertension in the short term. Okay, stop. So I know it's a lot. Take a moment, read it. I'm going to give you 1 minute, maybe 2. And then in the chat, tell me what you think the answer is. Again, this is nothing to get stressed out about. This is just to give you an idea, right? Having an understanding of what it kind of takes to understand these questions and how you're going to be. Can you show us the case again? Sure. No problem. So he got indapamide prescribed 2 months ago, first time by his doctor. He's about 35 days late in getting his refill. He has no refills left, okay? So that kind of tells you how much of a supply he got, right? Initially, usually, doctors in practice, they give a 30-day supply. That's typically what you see as an initial supply of medications. That's enough time for the patient to assess for efficacy or effectiveness, even adverse drug reactions or side effects. So typically 30 days. So that's what he has. There's no refills. And then there's this idea that possibly there's other things going on, maybe comorbidities. That means other illnesses that's happening. We have to monitor for his lipids. That's the case. Next. So stop at D. Yeah, perfect. Okay. So it's okay. Just whatever you guys think. I want to see some answers. Thank you for those that are participating. I really appreciate that. Keep going. Yeah. Okay. Okay, 30 more seconds, and then we're going to keep going. So one of the things in our course and with us is that we emphasize and encourage when we do tell you to participate and give your feedback and give your understanding. Just like communication, it's a two-way process, right? So you transmit information and you give the message, and then it's received, it's translated and transmitted back, right? Okay, perfect. So hopefully everyone had a chance to kind of get an idea. So the answer is C. And this is where it comes down to reading. Sorry, if you go back. This is where it comes down to reading the question carefully. What is the most appropriate initial course? We have a lot of knowledge as pharmacists. We have a lot of things going in our head at the same time, but it's very important to slow down and understand what is happening. So that's why, even in practice, myself, I always ask the patients the first time, for example, I see you're getting this prescription for indapamide. Do you want to tell me what is going on? Do you want to tell me what you know about the medication, what your doctor said, so on and so forth? So in this case, we have to ask open-ended questions to gather information to find out what's going on. Okay? So it's important. Great. Next. So upon asking about the delay, right? There's a delay. He's like about 30 days late in getting his next set of prescriptions of his indapamide. The patient explains that he has been taking his medication irregularly, only when he feels his blood pressure might be high. We may laugh, we may chuckle. This is true. This happens in real life. It's very important for us to understand. His use of his is based on subjective symptoms rather than following a consistent daily schedule. You ask if he monitors his blood pressure at home or if he has any recent readings. He reports not owning a home monitor for blood pressure, and he's not checking his BP regularly. The only recent reading he got was 141/93 at a community health fair, but he didn't follow up or adjust his medication based on his results. Okay, so these are two important pieces of information that happened after, or we found out after talking to them. So the question I have for you, okay, is given the patient's inconsistent medication use and lack of proper monitoring, what is the most ethically concerning implication? That's a fancy way of saying violation. Okay, what is most concerning implication if the pharmacist went ahead and did an emergency extension without further action? So basically, what we're asking here is if the pharmacist went ahead and extended the indapamide and gave the medication, what is most ethically concerning? And these are the statements that we have to assess. So that's the question. We have A, the pharmacist risks enabling ineffective use of therapy, which may compromise the intended benefit of the medication. Okay. So if they were to extend it, let me just, so there's a question here. Sorry, if you can, what was the answer to the previous question? Okay, so the answer to the, it's okay, Dr. Parry, fine, you don't have to go. The answer to the previous question was C. Okay, the answer was C. And now in this case, the second point is, or second option is, if we were to extend it, what is the most ethically concerning implication the pharmacist has to be aware of? So proceeding without clinical confirmation may overlook other patients who require closer attention, which affects fair allocation of care. Dispensing in this context without addressing the underlying issues increases the risks of unintended harm to the patient. And finally, A and B, highlighting concerns related to both therapeutic efficacy and a system level fairness. Look, basically what this question is asking is that if the pharmacist extends, everyone know what extension is? So there are powers that pharmacists are given now, much across the country, where if it's a chronic medication, the pharmacist is using their due diligence and their own insight, they would decide whether or not they would extend it without waiting for the doctor. So this is something that we prescribe on our own. We're extending a medication. So it would be under my name, for example. If this pharmacist were to do that, what is being violated the most? What is most concerning? So take a moment and just answer. And I'll break it down for you after, okay? So not to worry. Thank you for participating. I really appreciate that. We can get a few more. I'm going to wrap it up in 30 seconds, this question. Okay. I mean, going through our course and, us breaking down ethics in general, this would give us a much better foundation. And so we wanted to give you a kind of a more of a challenging type of a feel of a question. So, Dr. Farah, if you can give me the answer. Oh. So the answer is C. Okay. So C, dispensing in this context. So if we were to give an emergency extension without addressing the underlying issues, increase the risk of unintended harm. This is what's most important. This is what is most at risk here. Can someone tell me what this is also known as? This harm, risk of unintended harm? Can someone tell me what that makes you think of? Which principle, maybe? So this is where ethical principles come into play, right? So in this case, it's actually non-maleficence. If you go to the next slide, Dr. Farah. So the biggest ethical concern here is risk of harm. Since he's using his blood pressure medication irregularly and not monitoring his readings, if we were to give him a refill or extension without addressing these issues, it could be bad news. It can lead to unsafe or even worsening blood pressure. Now, you may argue, wait, you said that his reading was 141/93. That's not terrible. He's almost within target. Yeah, but that was one reading. We don't know when he took it, how he took it, how long ago. So we cannot bank on that. A is relevant, but this focuses more on the beneficence, right? We're not focused on that. So you can be like, well, if we extend it, then the patient can continue taking their blood pressure medication. That is true, but there's more at risk of harm than the benefit here. See, this is what we have to kind of guess. You can't just say non-maleficence is always more important than beneficence, for example, right? B is fairness or justice, but is not as important. And D, it's not really related. So that's why C is the right answer in this case, okay? Now, just to kind of wake you guys up a little bit, do you guys remember what the doctor wanted to monitor for? Can someone tell me what? Remember, we're talking requisition. What did the doctor want to look into? What did the doctor want to monitor for? Can anyone tell me? Three sides. Sorry, I'm not sure. Diabetes. Oh, gotcha. Okay. Lipid profile and diabetes. Yes. Okay. So hyperlipidemia. Yes, exactly. Thank you. Okay, that's good. Now, can someone tell me what is the potential concern with thiazide diuretics? So indapamide is a diuretic or water pill. It's a medication used for hypertension. Now, I know that this is more therapeutics realm, but what I want to explain to you is that it bleeds in together. You will see situations where you have therapeutics and management therapeutics sandwiched together in a case, right? What can thiazide diuretics do as an adverse reaction, as a side effect? Can anyone tell me? What can it do to someone? So when you start looking into these things, it's very important to understand contraindications or risk factors for certain people. So therefore, we know which drug therapy is best. So thiazide diuretics can increase sugars. It can cause hyperglycemia. Excellent. Thank you very much. And it can even increase lipid levels. Now, interesting little wrinkle. I just find this really interesting. I love what I do, and I love being a pharmacist, and I love pharmacology. Indapamide, turns out, has less of an effect on lipids. There's more studies that have to be done, but indapamide versus the hydrochlorothiazide or chlorthalidone, which actually is now back order, I think is back now. But compared to other thiazide diuretics, it has less of an impact. So if I was a clinician or I had to pick a drug for a patient that I'm concerned about for lipid levels, but they had to be on a medication like a diuretic for blood pressure, I would potentially pick indapamide. Okay, so I know that was a lot, and I know that it might seem a little confusing, but the main thing I want you guys to take away today is the kind of questions you may get and the way to think about and how to break it down. All right. So I'm now going to pass this on to Parmeet, Dr. Parmeet, and he's going to talk a little bit about the course itself and the schedule.
Thank you. So hopefully you all enjoyed those insightful discussions from both Farah as well as Parag. And that is just a little snippet of what we have when it comes to our teaching style, as well as what we do in the course. Now, of course, today was simply a management sample, but we do have more samples available for our therapeutics, all available on our website as well as our YouTube account in case you ever do want to go on and take a look at how we teach therapeutics. That is there as well. Now, right now, we are in the midst of a multiple or MCQ course. Our course did start in July 15 and will go all the way until October 16th. So yes, it did already start. We are in about week 3 at the moment. However, I do want to make it clear that in case anyone does join during the midpoint or now for the course, we are going to offer a session to kind of help you catch up. So any material that was missed in the first 3 weeks will be taken up again to help students who joined late catch up with the course content. Another question we usually get is this enough time to prepare for the MCQ exam? The answer is yes. Usually, if you are able to spend time and at least give yourself about 3 months, which is 12 weeks, it would be more than enough time to practice and study for the exam that you are going to write. Now, that in mind, the price of the course is $1,549, so $1,549, and you are given access to an extensive textbook. So we have all chapters available from day one for all the topics that we are going to discuss. You get access to the class slides, our extensive question bank. You get access to a midpoint management and calculations only mock exam. So there is going to be an exam after about week 7 or 8, which is going to focus only on management and calculations, as it is something many students struggle with. And then, of course, at the end of the 14 weeks, you get access to our mock exam, which is going to encompass therapeutics, management, and calculations, which is more similar to what you would experience in your real exam attempt. Another question which is very common is, are classes recorded? Yes, they are recorded. So in case you did miss a live class by any means, you're always able to go back and view the class at your own convenient time. Or if you just simply want to go back and re-listen to a recording to brush up on some therapeutics or management, you can always do that as well. Classes happen twice a week, Tuesdays and Thursdays, from 9:30 a.m. to 2:30 p.m. EST, so Eastern Standard Time, and it is about 10 hours every single week. So 5 hours Tuesday, 5 hours on Thursday, for a total of 14 weeks, which is a lot of content, but we have spaced it out in a way where we are providing you quality rather than just pure quantity. You are going to get a lot of information, but we are going to make sure it is spread out and not too overwhelming. At the same time, you get access to our WhatsApp group, where you have access to our mentors as well as the instructors, should you have any questions or concerns that come up. And you can always interact with your peers as well. So that is pretty much some information on the course. Now we will open up the floor to any questions you may have for either one of our instructors, Dr. Farah, Arav, Prag, or myself. We are here to answer any questions you may have regarding anything. Any questions, you can either type it in the chat or you can unmute and ask, whatever is convenient for you. And if there's anything else the other instructors or faculty members want to add, please.
Sorry, can I ask one question?
Yeah, go ahead.
Thank you. Appreciate all you guys about your presentation, but about the backlog coverage, I mean, the subjects that are passed, but you want to give us some lecture on them. How could it be manageable, considering that time constraints?
Sorry, what was your question? I didn't quite hear you. You were breaking up in between. Can you just repeat it? Or if any of the other people heard?
What I'm saying is just there will be some backlog courses, right? Meaning those who are covered earlier, but that we missed, and then in the meantime, you're gonna cover them. So while it's a good idea, but there will be time constraint as well, because we will cover the other as well as we will cover those ones. So how do you see these things? How is manageable?
Yes. So if I understood your question correctly, it is how are you going to manage the extra time allotted to people who are joining the course late versus people who are already in the course since day one? So
Correct.
yes. So the thing is with the EE results, they usually come out, mid-July or closer to the end of July. At that point, it would be too late to start a course from brand new. However, our course does offer the ability to catch up. Now, I understand that there might be an extensive time difficulty for someone who is trying to catch up on 3 weeks of content. But keep in mind that the recordings for those classes are already available. Plus, we are going to do a session to help you catch up. So the idea is you would go through the recordings on your own time, and then we would be able to do a session to help clarify any difficulties or confusions from anything you watched on your own time. Now, keep in mind that each class is about 5 hours in length. If you allocate one class per day for at least 6 days, you would pretty much catch up with the rest of the students. So I see another question here from Sharon. Can you help understand the scoring system for MCQ? So I believe Dr. Farah talked about this earlier, but when it comes to MCQ, and this also includes OSCEs, the scoring system is very different than EE. It is not simply you get a 60% and you pass the exam. With MCQ as well as OSCE, the scoring system is a comparative system, meaning that they will compare you on how well you prepare, how well you performed the exam compared to other people in the same cohort. So let's say, for example, November 2026, there's going to be a group of students who are going to write the MCQ exam all across the country. Now, when they are scoring the students, they are going to find the average of all students who wrote the exam, that seating across the country, and they will compare you to the average. As long as you are maintaining a score at or above average, usually that would mean you would pass the exam. If you are doing worse than the average, then that would unfortunately lead to a failed attempt. Is that clear, Sharon? Perfect. Any other questions about anything? All right. Is there anything else that any of the faculty members want to add in?
Just want to say on my end, thank you for joining us today on behalf of myself, SolRx. We're so excited and we're here for you through your journey. Dr. Parag, if you would like to.
Yeah, no, thanks. And yeah, no, I echo that same sentiment. It is a difficult decision, and you have to consider much. And I think one of the differences with us is, and we truly mean this, we want to support you in getting to your next stage, right? And so we bring that when we talk to you in our teaching, right? Is not just an action. It's actually an experience for us. And I think if we have that general attitude, it just would make the information flow that much better, and you can catch up and be efficient in your in learning, right? It's about learning, like studying smart and grasping the material properly, having a strategy in place. So, yeah, I think you guys will be okay. Just think carefully, and I hope you give us a chance in helping you in your next stage.
So another question that came in was from Saeed. If each part has its own score, is it possible to omit one part? Well, they're never going to omit one part. So they're not going to say, okay, we're going to drop the lowest score from any competency. Each competency is based or has its own score. And these competencies are the NAPRO competencies, such as patient care, ethics, communication, inter and intra-professional collaboration. However, each competency is having its own weight. For pharmacists, the heaviest weight competency is patient care. And then, for example, communication might be very low. But if you don't do well on patient care, but you do well on other competencies, again, it will impact your score because patient care is worth the most. So you have to be mindful. At the end of the day, it is going to be very difficult for you to determine which question is related to what competency. But the idea is if you understand the competencies, you're able to tackle the questions. So Chioma is saying, if we want to take both MCQ and OSCE at the same time, how do we manage both courses and be ready? So at the end of the day, when you are studying for either OSCEs or MCQ, I would like to suggest that you want to treat each like a job. If you are able to allocate 30 to 35 hours per course, then you are in good hands. But if you have other commitments going on in your life, such as family or work, and you're not able to allocate 30 to 35 hours per exam, so that would be close to 60 to 70 hours a week. If you're not able to allocate that, then I would suggest taking one exam at a time. The reason is if you do end up failing one of the exams, as an international graduate, if you're in Ontario, you would have to do the IPG program. Now, depending on which province you go to, the IPG program may be skipped, but that is something that you have to consider when you are writing the exams. So that I hopefully answered your question, Shioma. Perfect. So I'll leave you guys maybe 30 more seconds to ask any other questions. If there's no questions that are put in the chat, I want to thank everyone for taking the time out this evening and, attending the session. Hopefully you got a little bit of information for us. If you have any questions, please feel free to send us a message through WhatsApp at any moment in time or email us at solrxplus@gmail.com. And if you want to talk more about the course or just get more advice, please do not hesitate to reach out to either one of the faculty members. All right. Thank you, everyone. And that will conclude today's meeting.
Thank you. Good night.